Good morning. Fedison, I see you're on the call. Good morning.
Morning. Can you all hear me?
Yes.
Are we recording?
Yes, we're recording.
Okay.
And then I am sharing the agenda. Are we all able to see the agenda this morning?
Yes.
So we still have a few individuals still hopping onto the meeting. Fedison, do you want to start right at 10 or do you want to give it a little bit more time for individuals to keep jumping on the call?
Uh, it's up to everyone. I don't have a preference either way. We have one presenter today and an MOU review. I think that's pretty much it, right?
Yeah, that's going to be pretty much it. So we'll go ahead and give everyone till like 10:03 to jump on.
Sure.
Okay. If you're just jumping on the call, good morning.
Good morning. Good morning, Maria.
Good morning.
Wow, not bad. I was just at the Monterey version of this meeting, and they were at 40 or 50, and we're up to about half of that now.
We do have a dilemma where there is two different other meetings, Fedison, being held.
Yeah, we've talked about that.
Yeah.
But we're feeling like if we move these to the afternoon, we'll get more attendance.
I feel like we will. We've had a couple of partners reach out and kind of provide their feedback regarding the time frame that we have, because it is merging with the Kings-Tulare Homeless Alliance meeting held at the Hanford Salvation Army. And that meeting is actually a meeting that a lot of our partners actually
Yeah,
they
that makes
attend that meeting.
sense. Is there anyone in this meeting, and if you want to just raise your hand, that if we moved it to the afternoon, that you won't be able to make it? Just show of hands.
And I do see one hand up for Karma. And then Karma, if for whatever reason you're unable to make it,
Yeah, we're
okay,
gonna move it to, I think, 1:30.
30. Yeah, that's correct. It was 1:30 to 2:30.
Okay, that works.
All right. And then Fedison, we can go ahead and get started with the updates and introductions.
Yeah, it sounds good.
Do you want me to go ahead and go first?
Sure. You can go first.
All right. Well, good morning, everyone. My name is Maria Valdez. I am the Smart Referral Network Coordinator for Kings United Way. And
And
I Oh, go ahead. Sorry, go
Go
ahead.
ahead, sorry. Fedison Landicho, Director of Data and Digital Strategy for United Way of Tulare County, and I am also the interim SRN coordinator for the United Way of Monterey County.
Do you want to share the updates on Tulare, or do you want me to go ahead and?
Sure. So Tulare updates, Tulare SRN updates. We have one signed MOU. Um, the Tulare Joint Union High School District has signed their MOU. We're going to be onboarding them within the next few weeks, and then working with their teams to support their families with referrals. So happy to report.
Nice, Fedison. Congrats on your new partner. Um, for Kings, we do have since our last alliance meeting, we were able to onboard two new additional agencies onto our Kings County SRN program. Along with those two new agencies, we added 7 new active users to begin sending and responding to referrals to our Smart Referral Network program within Kings. And then that was our update for Kings County. I do have one more update I would like to share, Fedison, if you don't mind. This is going to be for our for both our 211 programs. Just a quick reminder to all of the partners that are currently on the call, if you guys are able to follow up with your local 211s, please be sure to follow up and update all of our 211 records. All of our listings on our 211 database are what is reflecting on our Smart Referral Network, so having those programs up to date is very crucial. Our Kings County database specialist is on the call. Her name is Laura, and she will be sharing her email. So if you are a Kings County agency, if you don't mind updating or reaching out to Laura to update that record, that way we can have accurate information for the database and the resources listed. And then Fedison, if you would like to share Ellie's email in the chat as well, we can get Tulare County resources
Sure, I can do
for
that right now.
all right. That way, Tulare County resources can reach out to her and get their records updated on their end as well. And then I'm just going to share a quick update, Fedison, for our Kings United Way office. So for our Kings United Way office, right now we are currently in the process of hosting a fundraiser. We kind of just wanted to announce our fundraiser. Our fundraiser that is being hosted will be hosted in the next couple of days. I want to say no later than this week. It is a Kiss the Goat fundraiser. Let me go ahead and pull up the image for you. This fundraiser is available for our partners. To be able to participate, this is going to be for you to be able to, our partners to raise individual funds for their agencies. Participating executive directors will compete to raise these donations. It is going to be based on $1 donations. Each dollar is counted for a vote. And then at the finale, we'll have that executive director from that agency. We're going to go ahead and go out to the Hanford Fairgrounds, to the Kings Fairgrounds, and they'll be able to watch that executive director kiss a goat live. The end of that fundraiser will be June 26th. If you're interested in learning more, please follow us on Facebook and Instagram, and we'll share that with you guys as well in the chat, and we'll share the flyer with you as well. And then just
Who provided the goat?
Kings County Fairgrounds did.
Oh, does that count
They're
as an in-kind donation or something, or
uh,
probably?
I'm gonna assume it probably does. So yeah, if you guys are interested in participating as well, please reach out to our agency, and we'll be able to have you guys participate and provide some funds if you guys want to watch that director from that agency who is participating kiss a go. And then just one final update I would like to share. Um, our Kings County, our Kings United Way affiliate application is still open. Applications are due this upcoming Monday, May 25th by 5 o'clock. So if you haven't submitted your Kings United Way affiliate application, if you can please submit that before the 25th at 5 o'clock, that way you're able to meet that deadline. And that's all the updates for me. Um, so we're going to go ahead and move on over to our presenter. We do have our HMIS on the call. I'm going to go ahead and pass it on over to Lucia. She can go ahead and introduce herself and then also introduce the presentation for HMIS.
Great. Thank you, Maria. Good morning, everyone. My name is Lucia Orozco, and I will be presenting today on coordinated entry system and about a little bit about HMIS and what that is and how all that works. I'm going to go ahead and share my screen and then share the presentation. Perfect. Okay. So we were lucky enough to get this PowerPoint presentation from our partner at the Kings-Tulare Homeless Alliance, Veronica White. She is the coordinated entry manager at KTHA. And we wanted to cover coordinated entry system because it's such an important system here in both Kings and Tulare County. So if you have any questions, feel free to add them in the chat, or we can leave some time at the end of the call to hopefully answer questions. Coordinated entry is a crisis response system that helps us connect the most vulnerable individuals in our community to available housing and supportive services equitably. It helps us identify individuals who are experiencing homelessness. It helps us align prioritization criteria. It helps us facilitate referrals to and from coordinated entry process, and it helps us coordinate services and assistance. So in this flow chart here, when an individual or a family is seeking housing assistance and they are homeless, they'll have two points of contacts in order to enter into the coordinated entry system. They can either go through a centralized system, which is calling 211 or meeting directly with the housing navigator, or through a decentralized system, which is going through a provider. And any agency can become a provider of coordinated entry system as long as they go through the necessary trainings. If they meet the criteria, they can continue on through that workflow. If they are at risk of becoming homeless, there could be some diversion as appropriate there. And then based on their household dynamic, if it's a adult-only household, they will complete the VI SPDAT, which stands for Vulnerability Index Service Prioritization Decision Assistance Tool, or the VIF SPDAT, which is specifically for families with children. And then they're placed on that housing priority list. So that assessment will prioritize them based on their vulnerabilities. It's a long assessment. It takes about 10 to 15 minutes, asking them questions about their situation at the moment. And based on that, with a couple other criteria, for example, how long they've been homeless, and maybe their health status and other criteria, they'll be placed on that housing priority list and prioritized based on their vulnerability. That is a real-time list of individuals needing housing. So when that list is pulled, it's the highest priority is identified, and that's how the housing navigators then create that referral to a bed opening. While a family or an individual is awaiting housing and is on that housing priority list, case managers can work with the family to get them document ready. And we can probably go into that in just a moment and what that looks like. But then once, like I said, a bed opening becomes available, that's when that referral or enrollment is created into that housing program, which ultimately leads to that enrollment. Coordinated entry does follow a housing first approach. A housing first approach means that they offer housing first, regardless of barriers such as disabilities, mental health, substance use, and criminal background. There may be a few exceptions there, but in general, that's the definition of housing first. Housing first is trauma informed, it is non-discriminatory, and it allows for harm reduction. The housing priority list, as I mentioned, is a real-time list of individuals or families experiencing homelessness. It's shared across agencies. It's generated with shared data, and it facilitates community decisions. The housing priority list is housed within our HMIS, which stands for Homeless Management Information Systems. HMIS is a client-level database that stores client-level information on individuals that are homeless or at risk of becoming homeless. And the HMIS system stores data elements such as veteran status, chronically homeless status, vulnerability score, housing status, and other additional factors that can help appropriate projects. We use the housing priority list to match people to housing programs based on availability, eligibility, and prioritization. The HMIS, like I said, houses the coordinated entry system. It holds all the data across many agencies that are in the Bi-County region. It stores common data elements as well as program data elements, and it's a centralized repository, and it tracks data over time. We implemented HMIS back in 2008, and since we've had over 40,000 unique client records, so it tracks that information for those records over time. So if a client was homeless back in 2015, and then they became or come to receive services again in present time, we could see that how they've improved or how they have gone through different types of programs throughout that time. It helps us monitor measures, for example, access to homelessness or recidivism. It allows us to look at and evaluate all of those programs. And then HMIS allows us to triage, address higher needs, reduce duplication of services, and meet needs with services. In our HMIS, there's different project types. We have shelters, transitional housing, rapid rehousing, service-only projects, permanent housing programs such as rapid rehousing and permanent supportive housing programs. And it includes different types of providers, including faith-based providers. HUD has a very specific definition of homelessness, and we are required to use HUD's definition of homelessness for HMIS purposes. And that definition is that individuals or families who lack a fixed, regular, or adequate nighttime residence. And it can include an individual in a place not meant for human habitation. It could be like an office, in an RV with no hookups, obviously a tent outside. It could be an abandoned building, even a garage, as long as they have no access to running water, things like that. An individual living in an emergency shelter or a hotel or motel paid by a government or charitable organization. So if another agency is covering their hotel stay, that's considered emergency shelter, and that would still define them as literally homeless. Or an individual that is exiting an institution where they only resided for 90 days or less, and they were literally homeless and in a place not meant for habitation or shelter prior to entering that institution. We also have a specific definition for chronically homeless. A chronically homeless individual or family is a homeless individual or head of household with a disability that has been living in a place not meant for human habitation or in an emergency shelter or a safe haven for the last 12 months consecutively or on at least 4 more occasions that add up to 12 months or more. They must have a diagnosable disability such as substance use disorder, serious mental illness, developmental disability, post-traumatic stress disorder, cognitive impairment resulting from a brain injury, or a chronic physical illness or disability. When they report that information in HMIS, it is self-reported. However, if they enter a program that has that criteria, they will have to provide documentation on that disability. Continuing on into the definition of homelessness, we have so literally homeless was category 1. We also have a couple other categories that can define an individual as homeless. And so category 3 is an unaccompanied youth under the age of 25 or families with children and youth who do not meet any of the other categories but are homeless under other federal statutes and have not had a lease and have moved 2 or more times in the past 60 days and are likely to remain unstable because of special needs or barriers. And then category 4 homeless definition is any individual or family who are fleeing or attempting to flee domestic violence, dating violence, sexual assault, or stalking, and who lack resources and support networks to obtain other permanent housing. In HMIS, we do have to document appropriately those types of homelessness, especially if they will be entering a project that has that criteria. So for category 1 homeless, HUD expects providers to attempt to get third-party documentation of homelessness status, for example, a homeless verification letter. So that so if you are working with your client and they can benefit from going into permanent supportive housing, you would want to work with a third-party agency or another case manager that has worked or is familiar with your client to get that letter of verification. That letter has to be very specific. We can go into that detail in just a moment. But if the client or household falls under category 3 or category 4, HUD doesn't necessarily need a third-party verification documentation. The client or household can self determine or self-report. And this means that to receive those types of assistance, self-certification by the individual or head of household seeking assistance is all the documentation that HUD will expect to see in that participant's file. Here are a couple programs that coordinated entry systems refer clients into. The first one listed is permanent supportive housing, which offers long-term rental assistance. However, an individual or household does have to be chronically homeless in order to be eligible for that project type. The documentation needed for that specific program type is some kind of identification, the homeless verification letter, and a disability form signed by a doctor, nurse practitioner, LMFT or LCSW, or have the SSDI award letter. The additional project type is rapid rehousing, which is short-term rental assistance. For that program, the only eligibility is that they do have to be literally homeless. They don't have to meet that chronically homeless definition, but they would have to be considered literally homeless, and they'll have to have documentation of that. And that's normally done through through a homeless verification letter. And in addition to that, they will need some form of identification. And then the third program type is a mainstream voucher or a move-up voucher, which, similar to permanent supportive housing, is a long-term rental assistance. The eligibility for that program is that they have to be literally homeless with a disability, and they must be between the ages of 18 to 61. Similar documentation needed is identification, that homeless verification letter, their social security card, birth certificate, income from the last 3 months, including CalWorks, SSDI, and any bank statements for the last 6 months. The documentations when collecting for your client or household that you're working with, this is what we refer to as getting a client document ready. And these documents can be uploaded into HMIS to their client profile that way, and shared with other case managers if needed. That way they can work collaboratively to get that individual or household housed quickly and efficiently. And these are just the main documents. Additional documentation may be requested if depending on the program that your client is being referred to. Here is an example of a homeless verification letter. It does have to be very specific. It has to have the date. It has to say identify the program that you work with as the case manager. You have to indicate how long you have observed or can identify that the individual you are working with has been homeless. provide as much detail as possible, including the client's name and the date that you first identified the client as being homeless or receiving homeless services from your program. So this is just one example. And then obviously you could put that on your letterhead and sign the letter and then upload that into HMIS. The letter, homeless verification letter, does have to be current. So if you're working with a client and it's been maybe 6 months that and you haven't completed another homeless verification letter, in order for them to move into housing, they will need an updated. So be mindful of that. The Kings-Tulare Homeless Alliance does have link programs up and around the Bi-County region. In Hanford, they set up every other Wednesday from 11 a.m. to 12:30 p.m. at the Episcopal Church of the Savior. In Porterville, they are set up at the Porterville Navigation Center as well. They're also there every other Wednesday from 9 a.m. to 11 a.m. and at the Visalia Rescue Mission in Visalia every other Monday from 1 to 3 p.m. I know we're getting short on time, so I'll try to hurry, but there are a few low barrier housing programs in the Bi-County region. These listed here are specific to Tulare County, but there is Eden House, the Porterville Navigation Center in Porterville, and the Visalia Navigation Center in Visalia. And these are all low barrier housing programs or similar to emergency shelter programs. So if your client is looking for emergency shelter and is seeking to move into housing in the near future, these would be good options. They do have to be referred to these programs. So if you have a family that could benefit from staying at Bridge Housing, please refer them or connect with a housing navigator at the Kings-Tulare Homeless Alliance. There's also a few affordable housing developments through the Bi-County region. There's programs through the No Place Like Home, like Finca Serena, Palm Terrace, North Star Courts, Sarah Village, Santa Fe Commons 1 and Santa Fe Commons 2, and the Lofts. And then a few home key projects, for example, Sequoia Village, Madison Gardens, The Majestic, Sunrise, and Neighborhood Village. These are all affordable housing units that could be available for clients that are homeless and need supportive housing. If you do not already have the ability to conduct your own VI-SPDAT assessments and are interested in completing VI-SPDAT assessments for your clients or potential clients, feel free to contact the Kings-Tulare Homeless Alliance, or you can probably contact us here at Kings United Way, and we can also put you in touch with the Kings-Tulare Homeless Alliance. They complete their VI-SPDAT training, which is a requirement in order to enroll clients into coordinated entry. You will have to have access to HMIS to create that enrollment in HMIS in order to place your client into coordinated entry. But there's always ways around that if you are very interested in coordinated entry. I'm not going to mention these for the sake of time, but if you do want more information, there is the website, kthomelessalliance.org, and I can put my email and phone number in the chat in case you do want to learn more about coordinated entry and or HMIS in general. That is all I have. I'll stop sharing. Are there any questions?
I have one.
Yes.
Can the homeless verification letter come from a probation officer that has verified that they're homeless, they're verified they're living in an encampment, or they're living somewhere? Could that also be used?
Yes.
Okay.
Any agency, if you work with them as a homeless individual and you can pretty much testify that they're homeless, you can provide a homeless verification letter and provide that documentation.
Okay. Thank you.
Oh, Leticia, thank you for adding Veronica's email in the chat. Veronica White is the coordinated entry manager, and she's the staff member that conducts the VI-SPDAT trainings. So if you are interested in becoming an agency that would like to enroll clients into coordinated entry, Veronica is the correct person to contact. Any other questions? Better not at the moment, but there hopefully are plans to do so in the future. We are hoping to be able to integrate the Smart Referral Network with HMIS, where it would be like a touch to view if a client is either enrolled or not enrolled into coordinated entry. So if you have access to the SRN and don't necessarily have access to HMIS, but you have a client that could benefit from coordinated entry, we are hoping that the two systems will be able to talk enough to determine if the client, one, is in coordinated entry already. If not, then you can move forward with enrolling them or helping them get into coordinated entry. And if they are, then you can provide that status update to your client.
Thank you.
I have one more question. How, for HMIS, is there a fee? I think, I don't know if I missed that in the beginning. Is there like a fee for the agencies to
Yes,
use
there's
and training that has to be specifically done prior to?
yes. So HMIS it's its own database, and it would have to be agency agreement signed and user agreement signed, and there's an annual HMIS fee.
Okay. Is there any way I can get like those specifics so I can run it by management for my agency?
Sure, I can send you the agency agreement, which includes the fee schedule.
Okay, thank you.
Do you provide a program that supports or provides a service to individuals that are homeless or at risk of becoming homeless?
Yes, we provide community navigation, and I'm the community navigator for my agency. So I work with them with the homelessness, with the resources, as well as referrals. That's what I handle for my agency, and I also go out to the encampments and in the streets with probation officers and by myself as well. So. Thank you.
Thank you.
I'm sorry, Alexander, I'm wondering which agency do you work with?
I work for Geo Reentry Services. We're partnered with Tulare County Probation.
Okay. Yeah, I would suggest you reach out to Veronica White to get
Okay.
connected. And then just to say, this meeting is at the same time as our case management roundtable. So right now we have the roundtable happening at the Visalia Rescue Mission on the third Thursday at 10 a.m. That's where all case managers, providers can connect. They go through the the housing priority list, and discuss any referrals through coordinated entry and any opportunities for housing. It can, sometimes there's 20 people, sometimes there's a lot of people. It just depends on, I think, the workload that people have that week. And then if you're in Kings County, we also have a Kings County kind of similar meeting that we've started the last couple of years. It's a services coordination meeting, and that's actually happening next Tuesday, thank you, at 10 a.m. and that's at the Salvation Army in Hanford. That we still restructuring it. If providers want to do trainings there, they can, but they've started really going through the housing priority list for Kings County clients who are enrolled in CES, and I hear there's a lot of conversations happening, so good things happening.
And is it correct, Leticia, that you don't have to be participating in HMIS or coordinated entry specifically to actually be partake in these meetings, these roundtables?
That's correct. It's open. I mean, it's technically open to the public, right? But we have a lot of CalAIM case managers, HUD funded COC case managers, and sometimes law enforcement attends. We do ask that everybody who comes in signs in, and there's a form, there's a confidentiality form there. So because they do go through clients in HMIS. I think it's like on the wall, and there's information that is posted, and they discuss coordination. So we do ask that people sign that.
Is there a notice for that?
I'm
Is there
sorry,
like
what?
is there a notice, like a time and date every month that gets sent out for that specific meeting or roundtable?
Yes.
Am I able to get notified for that? I would appreciate
Absolutely. I can make sure that you're added to both. Would you like
that.
both?
Yes, both,
Yeah.
please.
If you can put your email down here in the chat, and then we utilize MailChimp. So if your agency has like what do you call it, like a high firewall, you might have some issues, you can always let me and Veronica know. And then the Kings County one is just an email. We just send a big email. So yes, we'll add you, Alexander. And if there's any other folks that are interested, just let me know.
Thank you.
I always recommend case managers that are working with individuals or families that are homeless, and they have a specific situation that they're having trouble with, or some barrier for a specific family, that those meetings are the best meetings to advocate for your client. It helps you network with similar providers, and I've seen some really great things happen at those meetings. I've heard stories where there's a very difficult family that is just having so many barriers, and they literally talk through the situation, and they actually come up with a solution on the spot, because they didn't realize that the provider sitting next to them will be able to help them with that specific issue they were having. So it's pretty great to see that, how all those providers collaborate together to help their clients.
Awesome. Thank you.
Maria, you're muted.
Can you hear me now? Had my mic away from my, sorry, but thank you so much for providing that information. We're going to go ahead and move forward with our MOU review. If you have any additional questions for Lucia and for Leticia, feel free to drop those in the chat. That way we can go ahead and move forward. But thank you so much for the presentation and all of that information on HMIS. We're going to go ahead and move on over to our MOU review.
Thanks, Maria. Let me share my screen. Make sure. All right. Can you all see the MOU on my screen?
Yeah.
All right. So I wanted to do an MOU review, and that doesn't seem as interesting as maybe a software demo, but I think it's important to circle back to this document every once in a while, because I realize a lot of the partners that are using the SRN may not have been the ones to actually sign this document. What it does is it's 15 pages, pretty easy to get through, and it outlines how we all work together in the SRN, how data is protected, what each of us is responsible for, to any specific United Way that you sign this MOU with. And the Kings and Tulare MOUs are pretty much exactly the same language. So even though my document says Tulare County, all the same things could be applicable to Kings County as well. So I'm going to just go through this document section by section. I'm not going to read it all, but I am going to highlight some key points. And if anybody wants to take this document and go over it themselves, that's great too. But the beginning section is just an introduction on what the SRN is. The section under it, data sharing, it's what information is actually collected So to make referrals work, the SRN collects basic client demographic information, things like name, contact details, income range, education level, household size. Partners only see the information that they send or receive when they send or receive a referral, and the system prioritizes services based on eligibility. Importantly, protected health information is limited, and referrals to health services are handled with additional privacy controls. Cybersecurity, consent, and privacy protections. So this is a big one. It's 2 sections that I'm going to cover here. So before any referral is made, clients must give consent. So this consent form is available in English and Spanish and can be signed electronically, on paper, or verbally with documentation. All data is stored securely in an encrypted cloud infrastructure, and the SRN is covered by cybersecurity insurance. Clients also have rights. They can review their data and revoke consent and see which partners are part of the network. So that covers those 2 sections. In this section about confidentiality and privacy use of data, both parties, and when it's parties meaning the United Way you sign with and yourself, agree to protect each other's confidential information and only share it with people who need to know, using the same level of care as they would use for their own sensitive data. Personal information from the Smart Referral Network can only be used for making referrals, providing services, and complying with HIPAA privacy rules. Any information from the SRN must be stored securely on password-protected computers or locked up and not shared or used for other purposes. So that's the data and privacy section. So the community service partner responsibilities under this MOU. As a community service partner, you agree to actively use the SRN for sending and receiving referrals. The key expectations are responding to referrals within 7 days, following up so referrals lead to services, keeping your agency's services accurate in the 211 databases, which we talked about earlier, and ensuring staff receive confidentiality and HIPAA training. So that highlights all the sections under there. And design and implementation. Each SRN partner involved in this agreement needs to pick one person to be their main contact. This person is in charge of all onboarding tasks and setting up user accounts. And if they can't do the job or stop responding, the agency must quickly appoint someone else with equal or better qualifications within 10 days of a reasonable written request. And that is onboarding. After signing, we'll meet to complete onboarding within 30 days. Each organization designates a primary contact and system administrator, and that's this section right here. So data to be uploaded to the Smart Referral Network. Both the United Way and the SRN partner must make sure that the data they share in the SRN is accurate and up to date. Data about clients is uploaded or transmitted as specified in the agreement, and updates are required whenever new information becomes available. So if you get any new information on the client's income situation or anything like that, we would hope that you update that information in their profile. Data will only be withheld if the client hasn't given consent. So if sharing would break privacy laws or the agreement, or if the client has revoked permission. So that's that bottom section here. So United Way responsibilities under this MOU. United Way is responsible for maintaining the SRN platform, providing training and support, monitoring referral activity, and notifying partners within 48 hours if there is ever a data breach. Terms and term termination and legal provision. This MOU stays in effect unless either party decides to end it. Either side can terminate within 10 days of written notice. There's also a standard hold harmless clause that protects United Way from liability related to partner operations, except in the cases of gross negligence. So for example, if a partner agency mishandles a referral, gives incorrect information to a client, or fails to follow its own privacy procedures, that partner would generally be responsible for the consequences, not United Way. The hold harmless clause is there to make clear that United Way isn't taking on liability for another organization's day-to-day operations. The expectation would be if United Way itself acted with gross negligence or willful misconduct. And then we have a signatures page and the attachments. So these attachments A, B, and C right here, they all spell out what data is uploaded, client consent form, and HIPAA compliance requirements. So once signed, this agreement allows us to securely coordinate services and improve outcomes for the people we serve. So in short, this MOU creates a shared framework for trust, accountability, and collaboration. So referrals don't stop at a handoff, but actually result in help. So thanks everyone for being part of the SRN, or if you're a new or considering partner, hopefully this information gives you a better idea of the framework we're trying to establish, not just with the software, but with our collaboration. Does anyone have any questions? Oh, looks like I covered it all.
No, you're good. And so you know, Fedison, we're in the process of management is processing the MOU right now. So I still haven't received word, but we're looking at it.
Yeah, no worries. I know it could take time to send this up to the different levels. So yeah, perfectly normal.
And then I just wanted to add on that agenda you guys received today via email. You guys do have those MOUs available to you as well. So you can actually, you'll be able to locate those documents right under that section where it says Kings-Tulare County MOU review. You'll see the Kings highlighted in blue. That'll give you the MOU for Kings County for you to review. And you'll be able to also pull up the Tulare County by just selecting Tulare. You'll be able to pull up the MOU for Tulare County and review that as well.
And just to clarify, you only need to sign an MOU with one of the United Ways to be part of the SRN, the total SRN network, which is 3 counties and soon to be 4. Kings does have one more agreement after the MOU, right, Maria? So there's a special user agreement that
Yeah.
Kings is requiring, right?
Yeah, no, we require the user agreement for each individual who would want to gain that access as well.
Yeah. So whichever United Way you sign the MOU with, that's the one you report to. I guess your contacts work together with that United Way. If there's a data breach, then the communication would be with that specific United Way, whichever one you signed an MOU with. Because I know there are a lot of regional partners on this call that don't fit in one county or the other. So that's more of a conversation of deciding which United Way to sign the MOU with.
Real quick, Fedison. Upon approval of the MOU, is it one login or is it separate, or do we have to fill out some other forms for
No,
additional users?
There is no separate login for like a Kings SRN or a Tulare SRN. You log into one, you'll be able to get referrals from both or every county in the network.
Okay.
So there isn't going to be a separate login, and you only need to sign an MOU with one of the United Ways.
And then the individual participating agency will have one sign-in user, basically, or is
you
it?
can have an admin. So typically there's an admin, and the admin can create new users.
Can create more. Okay.
Yeah.
That's good to know.
But the Kings so the Kings side requires a extra user agreement.
Yeah.
So before you create those users, if you're a Kings, if you've signed an MOU with the Kings team, then you're gonna have to just fill out the user agreement form on their end.
Okay, thank you.
Right.
And then we also have our information as well for you guys to be able to contact Fedison and I if you guys would like to get an additional demo to get a live view of what we have to offer through the Smart Referral Network. So I'll go ahead and put our contacts in the chat as well so you guys can have those available to you.
Do we want to take any like general SRN questions for the last few minutes in the meeting or end early?
We can go ahead and take a couple of questions, but we do have to announce the time frame change for the meeting for those who
Yeah.
were not on the call. Do you want me to go ahead and do that now?
Sure, yeah, we should do that.
All right. So we have came across the conflict about us having an additional meeting during this same time frame for our Kings-Tulare Alliance meeting. So Fedison and I discussed possible time change for the meeting. So we are going to keep the meetings every third Thursday of the month. But the new time frame that we will be hosting the meeting will be from 1:30 to 2:30 p.m. So that way we would have the ability to have those who are not able to attend join the meeting. If you're not able to attend, Fedison and I are working together to get those recordings to you. We will have those available to you right after each meeting. So just reach out to us and we can go ahead and get that out to you guys. But for our next June meeting, it will actually be hosted on June 18th. And then it'll include that new time frame, and that invite will go out right after this meeting. So that new time frame would be from 1:30 to 2:30. Do we have any questions on the time frame change? No? Okay. Yeah, I mean, we still got 10 minutes for you guys if you guys want to just give us any SRN questions that you guys might have. We're open to answering any of those.
Yeah, I was interrupted during the presentation a couple times, so I might have missed a couple things. In regards to SRN, so there's training, right? Just to remind me that there's training involved for the SRN, like onboarding for the agency that's going to be partnering. There's like an onboarding. Each staff member needs to be trained how to use it, or is it one person from the agency gets trained and then they train other staff?
We would like for every user to be trained. And I believe Kings has the same policy, just for user what's the word I'm looking for? So we're all training and everyone has the same understanding of what the SRN can do. So admins can create users, but we would still like our teams to be able to train new users as they come on. So there's no confusion of how the system works.
Okay. That way it can be scheduled for staffing with our agency. So if we do train an admin, like for example, myself, then I could train, or I would have the other staff train with you and your team before they use the SRN.
Right. And I've seen a lot of group trainings too. So it's one calendar invite, but a whole group sits in on a training that I've seen work as well, if that saves people a lot of time.
Oh, absolutely. If we can put them all together, even better.
Yeah.
Mhm.
Maria, do you have any insight into how you do it for Kings?
Yeah, so for Kings County, in what we do is we actually we'll collect the MOU on behalf of the agency. Once that MOU is collected, we also do request those user agreements for each one of those individuals who would want to go ahead and get that access. We'll go ahead and set up a demo training with those individuals. And then most of the time, Alexander, it is a group training that is set up with them. So we'll set up a Teams meeting with them, go over the demo of the live platform of the SRN so they can have a better understanding of what tools are available to them. Once that demo is completed, we'll go ahead and gain them that access.
Okay, perfect. Thank you.
And if users leave your system, that's something that's also highlighted in the MOU. You have to let us know when someone leaves so we can deactivate their accounts.
Okay, so in case of a play termination or
Yeah,
what's the time frame for that? So once we find out if we were to lose a staff member, how is it listed somewhere?
I believe it was within 10 days.
Yeah, it's listed within the MOU, and it'll actually let you know that it's a 10-day time frame that the agency would have to communicate that to the SRN coordinators.
Oh, to the coordinator. Okay.
Mhm.
What about adding? If we add more users, do we still let you know ahead of time before we add another user?
I can answer. Oh, go ahead,
Yeah,
Fedison.
go ahead, Maria. That's fine.
For Kings, we would want to have a demo provided to the user. So we would just ask that organization who is going to gain that access to let us know and provide the user agreement on behalf of that individual. And then just let us know that we'll set up a demo training with that user and then they'll have access to the SRN because the agency was able to provide that access on their behalf. This is just so that they have a better understanding on how to navigate the system.
Okay. Thank you.
Did you want to add to that, Fedison, for Tulare County?
Oh, no. Yeah, I think you covered it.
Do we have any other questions?
Oh, real quick. Referral authorization and consent to release of information, that form. Um, I'm going through the cybersecurity part of the MOU. That form, is that available somewhere so I can review the forms that the clients have to sign before we put them into SRN?
I believe it's not well, if you don't have an account, then it's
Oh, you
usually
can't see it?
found there. But I think in the documents that I'd sent you,
Let me
so the
see.
whole MOU document that I emailed you a while back, it was
Okay.
all in there.
Oh, it's in
So
it's not
all the
that
attachments were, yeah, it's part of the MOU, but
packet.
it's attachment B. So
Oh,
page
see,
10.
okay. Yeah,
Yeah.
I just pulled it up. Thank you for adding. I pulled up the MOU, but I didn't see the attachment. Thank you.
Yeah, it's in there. All
Thank
right.
you.
All right, so I think that's, if we don't have any other questions, that's, I think Fedison, that's going to be it.
All right. Thanks everyone for your time.
Thank you, everyone. And then that meeting invite will go out in just a bit, okay, for the June 18th meeting at 1:30. Have a good rest of your day, everyone.
Awesome.
Thank
Thank you.
you.